you guys doing? This is Bound to Queen. Merry Christmas. I hope you're doing well. I hope that Christmas is going well. As for me, now everything's fine. So yes, today we're going to talk about something like, I think that is a right moment to talk about it, as we are celebrating Christmas, and we will go to celebrate in New Year, the festivities and everything going on. So we're going to be talking about breastfeeding and alcohol. Not to feel sometimes left out when it comes to people drinking alcohol around you. Sometimes when you feel like you would love to drink too, but just gonna kind of like tell you what the the health organization says, and what we ourselves as individual we should make of it, and how we should go about it. So yes, I feel like when it comes to alcohol, whether you're pregnant, whether you're breastfeeding, to be honest, I think that specifically for the first year, I would say for me, I feel like it's easier to just say no alcohol at all. No alcohol. When I say, why am I saying the first year? Because I feel like the first year of the baby, when the baby is born, is very important, to continue developing. I'm not saying after 1 year they're not developing anymore. I'm just saying that the first year is very critical. So everything is like kind of like coming into place, physically, mentally, psychologically, the neurons and all those are the connections and all this. So I really feel like because there's a possibility to pass alcohol on your breast milk, for me, I feel like we should just avoid alcohol altogether. However, if you consider, for example, what the NHS, which is the National Health what? So now if you consider what the NHS say, which is the National Health Service in the UK, actually is not clear. It's not a clear cut. According to them, is that you can have some alcohol, which is like maybe 1 glass of alcohol, but then again 1 glass is a bit, is 1 glass. If you get 1 glass of champagne or 1 glass of whiskey, it's not the same thing. It's not the same alcohol content. It's not. So that's what I'm saying, that when you're trying to calculate all those things, it's very, very complicated. So according to them, you can have some. The best thing would be like to avoid breastfeeding for like 2 to 3 hours. The time for the alcohol to kind of like clear in your breast milk. So the best thing is, for example, if you know that you're gonna want to drink, or you're gonna drink, or you're going out to drink, then it's like kind of like to how do you call it, to press your milk. There was a word, like when you want to use specific word are not coming, to kind of pump your milk enough for it to last, like, I don't know, maybe if you're going out in the evening, you know that you're gonna drink for the for that evening, like to go into the night. So if you can kind of like pump your milk so it can last for like maybe until next morning, because according to them you need 2 to 3 hours. So let's say that you had your last drink at 11 o'clock at night. So normally if you go to sleep and all those things, you wake up next morning 6 or 7 o'clock, you should be okay. You should be fine, and you should be able to continue breastfeeding your baby. But like I said, all those things, so it's good. It's good. I mean that for some people who really feel like they're left out, who really feel like everybody else is having fun, they're not having fun, because for them drinking is part of having fun, then it kind of give you a little bit of a window where you two can be part of it. But they also say that this shouldn't be like every day, it shouldn't be like every day, and it shouldn't be more than a specific amount of alcohol. I don't know what is the alcohol limit national. I don't know, because it's something that I know that I should have looked at her. I don't know. It also varies from country to country. But in the UK, they say you can have a glass of alcohol, and then you wait 2 to 3 hours before breastfeeding your baby. That's why. So once again, according to the NHS, National Health Service, occasional drinking is unlikely to harm the baby. So which means if you're drinking there and there, according to them, is unlikely to harm the baby. But then again, you know, like I said, that's very subjective, because you're saying that occasional drinking, how much occasionally? Because if somebody is drinking a bottle of alcohol every time that they drink, maybe every maybe 2-3 times a week, and every time that they will sit to drink is one bottle of alcohol. It depends on alcohol. It can be one bottle of wine, one bottle of whiskey, one bottle of champagne, and then they wait 2 to 3 hours to go and feed the baby. I don't think that's that are not exposing the baby to some negative effects of alcohol. I don't think so, because that, for some people, what you say occasional drinking, for some people can be one glass there and there, you know, maybe one glass 1 or 2 hours a month. For some other people it can be one glass or every day. For some other people it can be one bottle 2-3 times a week, you know. So it really depends. So that's why I feel like when it comes to that, if somebody really decides to breastfeed, it's better to actually cut the alcohol altogether. For me, that's how I feel. You know, that's only me. You only engage me, but that's how I feel. Because I feel like it's very subjective. It's it's not really completely clear. It cannot be clear for everybody. Once again, you know, we are not all equal when it comes to those things. Some people, the way that the body absorb alcohol, the way that the body react to alcohol is very different to others. You know, so we also know that the alcohol will also affect you differently, whether you are like somebody who is tall and kind of like bigger, and somebody who's petite and all that, they're doing the same amount of alcohol, it will not affect them the same way. So, you know, you have to consider all those things. And when you start considering all those things, it becomes very confusing. And that's why I really feel like it's better to avoid. The limits of alcohol are, you should look it up. Me, I did not look it up. They say that that is harmful to the baby. Obviously, we know that, you know. Moreover, drinking too much can also decrease your milk supply and affect your milk supply, and also affect the attachment development between you and your baby. Because for those who don't know yet, the different type of attachment when it comes to a newborn and the caregiver or the mother specifically, because the mother in general is the first caregiver, you know. So that the different type of attachment. So according to the NHS, if you drink too much, then that can also affect how this attachment will be established between you and your baby, which makes sense, because obviously somebody who drinks, the way that they drink, you know, there's a lot of aspects, whether it's a cognitive aspect, whether it's a physical aspect, which are inhibited, you know. So they don't behave the same way. They cannot interact with people the same way. On top of that, everybody react to alcohol in a different way, and everybody is affected by alcohol in a different ways, you know. Like I was saying earlier, somebody can drink a whole bottle, they will not even look like they're drunk. It will not even affect them. Another person will only drink one glass, and everything will be different. They will behave differently, they will act differently, they will do things differently. So those are also other things that you have to consider, because as a mother, if you have a young baby and you drink and you're drunk, you know, obviously because you're breastfeeding, let's say you're alone with your baby, the baby will be crying. If you are sleeping, I don't think that you'll be able to wake up to react when your baby is crying for you to attend to your child. So that's another danger, you know. Anything can happen. You know, not going to be that alert anymore. You're not going to be able to react to that quick anymore, and anything can happen. So that's another thing that for me, I feel like I said before, you know, I said earlier that drinking reasonably doesn't mean the same thing for everybody. One person will drink one bottle of alcohol, they tell you that they're being reasonable the way they're drinking, because normally when they do drink, they will drink more than that. Another person being reasonable in drinking will be one glass of alcohol, and they will stop it. They will be able to actually to stop themselves. They will not be tempted anymore. They will continue drinking juice or water or anything like that. Some other people don't have that control when it comes to that. They must stay sometime without drinking, without that affecting them at all. But from the moment they start drinking, they test alcohol, they have to continue drinking. And when it comes to that, you know, they can't stop. So sometimes they have to pass out, or somebody have to use force to kind of like take them away from the alcohol. So that's another thing. Because you need to keep in mind that that's what alcohol is. Alcohol is like a addicting. You know, you can get addicted to alcohol. This is not just something that for most people you just do and pass. No, this for some people, even though they are not normally drinker, but once they touch alcohol, then it become addicting, and they are struggling actually to stop drinking at that specific moment, and then it can go really really far. I already talk about the behavior, you know, like I say, yeah, people behavior when it comes to alcohol are very different. They are very different. And like we say, alcohol kind of like mask uh uh, uh mask certain aspect of how people feel. Kind of like a numb, you know, numb cognitive, many cognitive aspects. So obviously if you're drinking, you're not gonna be uh, uh as you are normally. That's that we can't lie to ourselves. It kind of like touches certain thing, affects certain thing that will actually make you behave differently from normal. We're not even talking about the effect on the baby, because now right now we are just talking about how will affect the behavior of a mother towards the baby and all those things. We also know that the more you drink, the more you have chance to pass your alcohol on your breast milk, and that too, like we said, will affect the baby. And that one, nobody in here this day is really capable to say what exact amount of alcohol is harmful to a baby, whether a woman is pregnant or a woman is breastfeeding. They don't know for sure. No one know for sure exactly the amount that is harmful to a baby. So that's why I feel like it's very, very important. You know, when it comes to breastfeeding is a choice. Pregnancy, not too much. We know that a lot of people get pregnant without like really wanted it. You know, they did not look to get pregnant and they can find themselves pregnant. But when it comes to breastfeeding, is a choice. So I feel like when it comes to all those things, you really, really need to think about it. If you are somebody who love to enjoy yourself, a part of enjoying yourself is drinking, and you know for sure that you're not going to be able to resist 6 months, 1 year, then maybe it's better to choose another way of feeding your baby. Because and not only that, you know, you also have to keep in mind that even if you're not breastfeeding your baby, if you're drinking too much, you will expose your baby to certain danger. So you have to think about all those things. I don't like being negative. I know that, you know, people live, like most people say, I only have one life. I understand that, even though I don't believe in having only one life. But I understand that it can be frustrating sometimes to see that as a woman you give up so much, you know, from the pregnancy to labor to giving birth to now if you decide to look after the baby. Even if you have somebody who is very, very supportive, that person is not even giving up, not even 10% of their life like a mother does. So I can feel like for some people it's frustrating. It's like, you know what, now that I had a baby, I'm not going to uh, sacrifice any part again of my living because of that, because I'm not the only one that had a baby. I had a baby with somebody who their life never changed, but my life, every aspect of my life has changed. So I don't want that anymore. I understand that. You know, I understand that. Even though I feel like, you know, but I understand. So that's why I think those things that you really need to think about them before making any decision about breastfeeding or anything else, because it's very, very important. I feel like yes, whether you wanted a baby or not, whether you wanted to whatever, the baby at the end of the day is the innocent person in the middle of all this, because the baby was hold and then hold hand did not ask to come. So from the moment the baby is there, we really have to try our best to try to give them the best in life. That's just what it is. You know, when it comes to kids, it's really something that I don't joke with. You know, I don't joke with. Understand that is freedom. Everybody is free to be free. But once you have a child, you cannot be free anymore. So that's why it's very important to think about having babies, because what people say doesn't even get any closer to the fact that your whole life changes. Everything about your life will change. and there's a lot of things that you will not like, especially if you are not ready for motherhood. You will not like. So just think about that before having the baby. And beside that, what I can say is that if you like the fact of, like, you know, socializing during Christmas, New Year, and all those things, there's a lot of drink beverage out there who, I mean, for the taste like the same thing with alcohol, but they have no alcohol. So you just drink that, so you'll be back. Everything at the end of the day, everything starts in the head. So you can convince yourself that I'm drinking champagne, even though that champagne have no alcohol. You know, that will make you to be feel like part of the thing and to enjoy yourself, if that's what you need to enjoy yourself. On this, take care of yourself, and I'll come to you again soon. Bye. Please, 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 I forgot to say that it doesn't really cost anyone anything, you know, but it's very important that if you're watching the video, whether you're watching the video for 1 minute, for the whole you're watching the video, please don't forget to like. Liking allows to kind of share, to kind of like for more people to get to watch the video, to go to see it, so to expand, you know, to share the message and all those things. So please don't forget to share, like, and subscribe. On this, I'll see you again soon. Take care. Bye.